Hi, everybody. Here we are in June already. We had a really nice Memorial Day, and I hope you did as well. And we are heading into our summertime, where I sit today in South Florida. We know that the hurricane season has started, but Mother Nature's biggest surprise right now, it doesn't relate to tropical weather, it relates to fires in Canada, which are out of control and have now impacted much of the United States. That impact is terrible air quality, and you're going to hear some new terms about this now. Air quality that's worse than any place else on the planet. Almost surreal shots of our major cities, including New York City, with what looks like a Martian environment. Orange-red coloration of the sun in the midday, with air quality that is horrible. Why is that? So actually what we can see is not really what affects us. There are smaller particles that are produced by the burning of woods and dust that are part of the environment in Canada. Those very small particles get into your lungs and impact how your lungs are functioning. And for anybody with chronic respiratory problems, this is a real threat. So asthma, COPD patients, anyone with underlying heart disease, which also has an element of pulmonary disease, all of those people are staying inside, filtering their air. Here we are, N95 masks. You didn't think you'd hear that again, but N95 masks are being recommended for anybody who goes outside who has respiratory problems, and even if you don't, if you have to work outside, a more complete filtration mask, which is what an N95 is healthier for your lungs and your cardiovascular system. We also, in many communities now, still have the allergens in the air, so a combination of things that you're breathing in really are quite hazardous right now for the health of many people, and we certainly are seeing those people in the EMS system now. We are getting a disproportionate number of calls for respiratory distress, difficulty breathing, that relate to very poor air quality. So for those of you in the affected areas, and I will be there tonight, we have significant issues. We're waiting for a bigger weather system to come and move this dirty air out of the United States, and for better weather in Canada, and for the firefighters there to be able to get those wildfires under control. So if you don't think we have a connected planet, this is another piece of evidence that we clearly do. In my Atlanta days, there was a Saturday where we had smoke coming up from fires that were 250 miles away in Savannah, in the Savannah, Georgia area. That smoke, that weather day, was kept on the ground and moved into the Atlanta metro area. And the smoke was so thick moving into communities that we had structure fire calls for what was smoke coming from wildland fires 250 miles away. Now we have fires that are occurring in Canada that extend across the northern tier of our states, and in particular in the New England area. And those are hundreds and hundreds of miles away, impacting air quality to the point where it's the worst on the planet. So for those of you in those areas, that's clearly modification of activities. For the fire EMS personnel, many of you will be wearing an N95 and something to cover your eyes so that you can at least reduce the irritation to you, particularly if you're caught outdoors in operations. We know that this has shut down sporting events and outdoor events, and it has shut down our kids who are doing baseball and soccer tournaments. This isn't healthy for them at all. And so be aware that that's going on and its impact, and that is that heavy concentration of smoke moves around on the East Coast and the northern tier of the United States. There will continue to be impacts. What else is going on in our world? We have some respiratory diseases, and what you're going to hear now, what's really different about now is you're going to hear the names of viruses that you've never heard before, and very frankly, we haven't talked about much before, and very honestly, they are kind of research items, and for for the scientific research and immunology people were of interest what viruses were passing around the country over time. The human metapneumovirus is currently what is circulating at the highest levels in the United States. I have a respiratory infection, which I've had now for a month. It is no doubt that human pneumorespiratory virus. And it is not impacting me in a real significant way, but I still have this hoarse voice and a chronic cough. And many people around me have the same thing. So the human metapneumovirus now has a name, and it's in the headlines. And ordinarily in the summer, we don't test for any of these viruses or their typing, but because of COVID, we now stick swabs in noses, and it gives us a result that says, is this COVID, yes or no? And it may also test for other viruses that otherwise would have been nameless. And lots of us get spring and summer colds and would never, ever have been tested, would never have had a swab put in our nose. But now we're testing for COVID, and we still have COVID circulating around. We still have a few patients in hospitals with COVID, and unfortunately, we have a lot of people with long COVID who are still greatly suffering after their initial infection with the bug. What is going to go on in the fall, just so you're aware, a couple weeks ago, the public health emergency ended in this country. That changed reporting and financing. We still are following patients in hospitals the way that we would have followed in prior years who had the flu, and be able to report out how many flu patients were inpatients in the hospital. Now we report on how many COVID patients are in the hospital. We have vaccines and treatments that were purchased by your federal government and are still available for free for you through certain avenues, including local public health and some of our retail pharmacies. You would call and say, I want my COVID vaccine updated, and is it available and at what price? And you would get that information. In the local areas, they might also know where the federally purchased vaccines are still available for free. The same with our treatments, and right now our treatments are the oral medicines, molnupiravir and Paxlovid. And those two treatments, some of them were purchased by the federal government and still available for free. In some cases, they're no longer available for free, and you'll have to pay like you would for a flu medication or an antibiotic that you're using to treat strep pneumonia. So those are some of the changes that are going on. We have, with the end of the public health emergency, we have lost the use of certain products, but we have not lost the use or the emergency use authorization for our vaccines. So the vaccines are changing. They're now bivalent, and they'll be shifted a little bit again as we go into the fall. The exact same way that we do every year for the flu. And each year in this year, they will modify from what was given last year into a 2023 flu vaccine. It will have authorization from the FDA to be given. Right now, the emergency use authorization for Pfizer, for Moderna, and for the Novavax vaccines is intact, and you can get any of those three vaccines. About a week ago, the emergency use authorization for the Johnson & Johnson vaccine ended, and that vaccine is no longer available. And for those of you who got the Johnson & Johnson vaccine, it is still effective, but they're not going to give any more of that vaccine. Instead, the other three manufacturers will be moving us into the fall, and we will be using those three types of vaccines in a tweaked version for the fall for us to go through and get our updates on our COVID vaccines. I told you before, this fall we will not have combined flu and COVID vaccines, and that is true. We will still have the individual vaccines, so they'll still require a jab and a jab to cover you from both respiratory diseases. This week, they released the information about molnupiravir and Paxlovid, which are the oral treatments. And in both cases, those oral agents given early in the course of COVID reduced deaths, and in particular, Paxlovid reduced hospitalizations related to COVID, and the people who took them versus people who did not take them. So for those of you who get sick with COVID, you will notice that treatment is extended to you. And the benefit of taking that treatment is to reduce the chance that you'll get severe disease and be hospitalized or die. So we have a lot going on in the healthcare arena in the country. Very, very warm weather is here, including up in the Midwest and the New England areas where the temperatures are hot. Right now, we don't have a whole lot of rain going through that area, so the air is not getting cleansed. Some of those sweltering temperatures are a little harder to take in June, the first 2 weeks of June, than they will be when the same temperatures arrive in August. So for all of you who work outside in the public safety arena, please be aware you're more at risk for heat-related illness now. So take care of yourself and the people in your community. And for those around you who are at risk for heat-related illnesses, make sure you take care of those people who don't have air conditioning or other ways of cooling themselves this time of the year. So DocTalk, beginning of June, a lot of active topic areas. Our next DocTalk will be just before the 4th of July weekend, and we'll talk about 4th of July prep as we get into this wonderful summer season. So take care of yourself. DocTalk, beginning of June. Take care. Thanks.